next topic is about dysmenorrhea. As you can tell, I have a special spot for gynecologic disorders because I used to practice as an OBGYN, and basically I made Casey agree to this. But actually, the thing that surprised me the most about um, TCM, traditional Chinese medicine and acupuncture, is that I found it really effective for dysmenorrhea because personally, it really did help me because I used to suffer from dysmenorrhea since I was a teenager. And I used to take a lot of medications, pain relievers for it. And as an OBGYN, I was really only taught to provide, to give patients oral contraceptive pills to at least temporarily decrease dysmenorrhea. But as we know, not everybody is amenable or are agreeable in using hormones for any kind of diseases. So what is dysmenorrhea? What does it mean when a person says she's having dysmenorrhea? It basically means having painful menstruation. So dysmenorrhea is a real thing. A lot of women actually suffer from this. It's actually pretty debilitating. It's quite common too. So there are two kinds of dysmenorrhea, the primary dysmenorrhea and the secondary dysmenorrhea. And primary dysmenorrhea, basically, it occurs in the absence of an obvious pelvic pathology. A lot of people, it basically means that there's no fibroids, no endometriosis, no other anatomic problems, but the patient still experiences some form of dysmenorrhea. So this can occur as soon as the female has her period. Shortly after that, it usually can happen between 48 to 72 hours. It's cramp-like or labor-like pain. So it's really debilitating. Sometimes it reaches a point where the individual can't actually work anymore because it's really that painful. If there's lower abdominal pain, it can also radiate to the back or the thigh. The most important thing is when you do an ultrasound, transvaginal ultrasound or pelvic ultrasound, there's no obvious reason why the person will have these pains or these symptoms. So for the secondary dysmenorrhea, secondary dysmenorrhea, it is due to an identifiable organic disease. So it usually occurs between 20 to 30 years old, and usually the patients do not experience any symptoms from the time they started. And then when you have a gynecologic consultation, first thing that they would ask usually is either an abdominal ultrasound, a pelvic ultrasound, or a transvaginal ultrasound. And then they would find something that is anatomically wrong in the reproductive organs. So a secondary dysmenorrhea is characterized by having heavy menstrual flow or irregular bleeding. It usually occurs during the first or second cycles after menarche. So it not unlike the primary dysmenorrhea, it can actually start after a few cycles. So like I said, there is your gynecologist will actually find something. It doesn't usually respond to NSAIDs or pain relievers or even to oral contraceptive pills. Although gynecologists will actually try to give you OCPs because there are instances that it is actually helpful, specifically for patients with endometriosis. Secondary dysmenorrhea can also be related to infertility, dyspareunia or painful sexual intercourse, and vaginal discharges. So in this picture, it basically shows you endometriosis, which is a common pathologic disorder that can cause dysmenorrhea and infertility. So next slide, please. Okay, so what causes primary dysmenorrhea? So one thing we have to understand about menstruation is when a person is about to have her period, the individual will have some form of inflammatory reaction in the body for the endometrial lining to be eventually sloughed off. So in this case, there are inflammatory factors, inflammatory chemicals that will make you more reactive or sensitive to pain. So one of the the chemicals that they have found to be related to primary dysmenorrhea is the prostaglandin F2 alpha, or the PGF2A, which is a potent myometrial stimulant and a vasoconstrictor in the secretory endometrium. So what happens is when there's an increase of prostaglandins, the endometrial lining will undergo some form of ischemia, and it will be released or sloughed off from the uterine cavity. So another chemical that is related to primary dysmenorrhea are the leukotrienes, which are also inflammatory mediators, and they have been postulated to heighten the sensitivity of pain fibers in the uterus. So the posterior pituitary hormone, or the vasopressin, is also involved in myometrial hypersensitivity, reduced uterine blood flow, and pain in primary dysmenorrhea. So what happens is when vasopressin is elevated, the uterus, which is a smooth muscle, it constricts, and in turn, it will also constrict the blood vessels. So, like I said earlier, there's an ischemic nature that is happening in the uterine cavity. So when there's ischemia, there's a decrease in blood flow, a consequent decrease in oxygen, which can be translated by the body as pain. They've also found out that women who experience dysmenorrhea appear to be more sensitive compared to women without dysmenorrhea when it comes to pain. So these women may actually be more sensitive to inflammatory mediators, even during the phases of menstrual cycle when they're not supposed to be experiencing menstrual pain. Other factors that can influence primary dysmenorrhea are behavioral and psychological factors. So it is likely that if you are experiencing depression or anxiety, you may have pains all over, you may experience pains in the body. So some causes of secondary dysmenorrhea, or the possible pathogens or pathologies that they might find, are endometriosis, pelvic inflammatory disease, ovarian cysts or tumors, which is actually chocolate cyst or endometrial cyst, adenomyosis, which is basically having endometrial tissues within the muscle tissues, or the muscular wall of the uterus, fibroids or leiomyomas, having intrauterine adhesions, and congenital malformations such as bicornuate or subseptate uterus. So when you say bicornuate uterus, it's not one hollow organ, but it actually looks like it has horns. And with the subseptate uterus, your uterus basically looks like a duplex, but it has a separation in between. So the most common cause and most enigmatic of them of the cause of secondary dysmenorrhea is endometriosis. Basically, with endometriosis is that you have a lot of endometrial tissues that are implanted in different parts of your body, and that includes the ovaries, the fallopian tubes, the pelvic cul-de-sac, even as far as the intestines. There have been reports of having endometrial tissue implants in the lungs as well. So these endometrial tissues actually react much like the endometrial lining or the endometrial tissues within the uterus. So if there is an increase of inflammatory mediators or inflammatory chemokines in the body, so these implants will also react the same way. So they will also undergo some form of ischemia, a depletion of the oxygen flow, and then they can also release inflammatory mediators, which can cause an overall inflammatory reaction within the body. So it really worsens the pains that the patient will experience. Okay, next. So what are the risk factors for dysmenorrhea? So early menarche, nulliparity, heavy or prolonged menstrual flow, smoking, positive family history, obesity, fibroids, having a tubo-ovarian abscess, ovarian torsion, endometriosis. You'll notice when you say early menarche and nulliparity, it basically means that there is a prolonged exposure to estrogen. So with nulliparity, it means you've never been pregnant before. So you will always have an elevated estrogen. So when you have elevated estrogen in your body, the endometrial tissues are more stimulated because if you look at the menstrual cycle, the endometrium will thicken, or they will proliferate if there's estrogen. And then when you have progesterone, which happens usually when you get pregnant, there's a decrease of estrogen, and then that progesterone will decrease the endometrial implant. So there are actually patients who, after they become pregnant, they no longer have endometrial, they no longer have dysmenorrhea. With smoking, it's basically because when you smoke, there's a decrease of oxygen flow. So if you are exposing yourself to an environment or a condition where you are basically, okay, hold on. When you're basically depriving your body of oxygen, then that will worsen the situation. That will increase the inflammatory mediators within your body. You are likely to experience dysmenorrhea if your mom or your sister also experiences dysmenorrhea. With obesity, usually with obesity, there's an increase of peripheral estradiol or estrogen. So this will not help you eat. This will not help you, or it will not help with, trying to decrease dysmenorrhea-like symptoms. And also with obesity, there have been findings that there is elevated inflammatory mediators within the body. So that increases your risk, or your chances of experiencing dysmenorrhea. With tubo-ovarian abscess, basically your fallopian tubes have they may eventually develop stenosis, or they would develop your reproductive organs will develop adhesions, which will cause an irregularity in the anatomy of the reproductive organs. So that can also, and also because an abscess it can cause inflammation. So that will worsen the condition. Ovarian torsion, I wouldn't call it dysmenorrhea, because that is actually, if you're having pains from ovarian torsion, then you should be going to the ER, because that's already considered an acute abdomen, and you should undergo surgeries for that. Next, please. Okay, so what are the most common symptoms of dysmenorrhea? So the most common one is cramping pain in the lower abdomen, often at the onset of menstruation. And some women actually experience dysmenorrhea soon after they reach mid-cycle, because that's when ovulation starts. They also experience backaches, body pains, headaches, nausea, fatigue. Some people end up vomiting too if it's too much, and also fainting in severe cases. Next, please. So what is the perspective of dysmenorrhea according to Chinese medicine? There are actually a lot, but in our lecture, I just chose the most common ones, which are liver qi stagnation and blood stasis. So the liver, according to traditional Chinese medicine, it's the one responsible for the flow of qi and also of blood, because blood doesn't flow without qi, so they go together. So as you can see in this diagram, the liver channel actually goes through the genitals. So if there is something wrong with the channels, you will most likely experience some form of pathology within the genitals. And in this case, if there's something wrong with the liver, among women, you're likely to experience dysmenorrhea, some form of dysmenorrhea. So the liver channel has a close relationship with the reproductive organs as it passes through the lower burner, or the lower part of your abdomen. The liver also has a lot of relationships with other organs. The liver can affect the spleen and the stomach, and the liver contributes to blood stasis, blood deficiency, and also with yin deficiency. So in TCM, we always hear people talk about the liver attacking the spleen, or the wood attacking the earth. And this is also the reason why some people will experience gastrointestinal upset when they have dysmenorrhea-like symptoms. And also, if you have a poor diet, but as we all know, spleen actually affects everything. You know, the spleen energy will affect everything. So if you have poor diet to begin with, then it's likely to contribute to dysmenorrhea-like symptoms. That's why, you know, I've encountered patients before that, and also consult OBGYN consultants who would actually advise their patients to veer away from processed foods, or processed foods, and even carbohydrates in some, because it causes inflammation, an inflammatory reaction in the body. So because the liver contributes to blood stasis, the blood and yin deficiency, so blood stagnation and liver qi stagnation, they all are they are actually related to one another. The liver channels also seem to affect, well, it influences the sinews. So if there's constraint within the liver qi, there's spasm of the smooth and skeletal muscles. So like I mentioned a while ago, the uterus is actually composed of smooth muscles, and it tends to contract. So you can relate it to that. You know, if the qi doesn't flow that well, and it doesn't, deliver blood that properly, the uterus will also be spastic, and that spasm causes dysmenorrhea, the dysmenorrhea symptoms, or the pain that the patient could experience. So there is also chronic hypertonicity, which affects circulation of qi and blood, which is not this theory is actually not far from how Western medicine explains it. So it also has a relationship to the emotional state of the patient. So as we know, as I mentioned a while ago, if you are depressed, anxious, that actually contributes to having cramp-like symptoms or having dysmenorrhea symptoms. And this actually, this agrees with the TCM perspectives. So when you have liver qi constraint or liver qi stagnation, it can manifest as abdominal pain with stress. It can occur premenstrually. You may have headaches, dizziness, poor appetite. There's irritability. You may experience irregular periods, also sore breasts. The tongue can be pale, especially on the edges, and the pulse may be fine or wiry. Next slide. Okay, so as I mentioned, blood stasis can also cause an obstruction in the movement of qi and blood. So with TCM, there are two main reasons why your blood is, clotting. First is you might not have enough blood, which means even in the Western perspective, if there's not enough blood, your blood tends to coagulate with each other, causing some kind of either thrombus or an embolus. And there may be an underlying dampness in your body, which also causes some kind of, basically the blood becomes sticky because of that, because of the presence of phlegm and damp in the body. So chronic blood stasis can eventually can be complicated by various degrees of deficiency in our phlegm and dampness. So the blood dysmenorrhea secondary to blood stasis is characterized by having focal, sharp, or stabbing abdominal pain. It is fixed in location and worsened with pressure. It can occur anywhere within the abdomen, whether it's in the right hypochondrial region, the epigastrium, as well as the right and lower quadrants. There is dark or purplish spider nevi or broken vessels on the trunk, inner ankle, or knee. So basically you have varicose veins, see the tiny ones. You may have dark, ashen, sallow, or purplish complexion, dark or purplish lips, and conjunctiva, dark rings around the eyes. I haven't seen a patient like this really with these characteristics. But menses may be irregular, dark or purple, and then they can actually let you know that there are blood clots whenever they have their menstrual cycles. So the tongue may be purple or with brown or purple stasis spots. The sublingual veins may be dark and distended, and the pulse may be fine, and it's not blurry, fine and wiry, or choppy. Okay, so I think Casey will take over.
So herbs, and actually a formula we're going to just pick out because it's kind of famous. Si Wutong. This herb, these four herbs are, historically famous, as well as modifiable by 100 different modifications that we're going to, as practitioners, we're going to run over them quite a bit. Tongwei, four combination, is another name for it, four substance decoction. And so it's pretty basic. We have Shudi Wang, Bai Xiao, Dongwei, and Chuan Xiang. And when you start looking at these herbs, if you take a few out or if you add more to it, they become other formulas that are also modified formulas to treat different pathologies of dysmenorrhea. So with Shudi Wang, we're looking at strengthening the liver and kidneys, as well as nourishing the yin and of the blood. And in pairing with Bai Xiao, it strongly nourishes liver blood, which is typically deficient in dysmenorrhea. And so Bai Xiao is a blood nourisher. It preserves the yin as well. It also calms liver yang, which alleviates pain as well as like stress and anxiety. With Dongwei, it also nourishes the yin and blood. And paired with Shudi Wang as well for dizziness, blurred vision, dysmenorrhea, and blood deficiency or blood stasis, which is that's the most painful element of the blood. So Dongwei is another one we know from Jiawei Xiaoyao. These two are in Jiawei Xiaoyao San. Dongwei nourishes and invigorates the blood, regulates liver and kidneys. It also regulates the menses and alleviates pain. And so paired with these three, combined with these three for menstrual irregularity, amenorrhea, dysmenorrhea due to blood deficiency or stasis. And Chuan Xiang is a big one for invigorating and moving the blood. And so this one is really good for alleviating pain and the stagnation. And so it's good for any blood deficiency cause, any problems related to dysmenorrhea or scanty menses or amenorrhea. And so when discussing just a few modifications of this formula, another one we know is Tao Hu Si Wu Tong, and that has Tao Ren and Hong Hua in it. And that one is for full out blood stasis. And then when you're looking at maybe a little more bleeding or restless fetus, you can add Aya and Ijiao to it, and that becomes a whole nother formula. There's literally 100 different formulas that this thing can be added to or changed to be a part of. And so many different studies to research and find. Taiwan was another one that had a lot of organized studies on this formula treating, 3,400 women in the study, and it was one of the primary ones they used. And so now we're into alternative treatments, and craniosacral therapy is one that I personally really like for dysmenorrhea, and it's often referred to as just craniosacral or craniosacral therapy. It's the type of bodywork that relieves compression of the bones, the sacrum, and in the dural tube and the spinal column. So that's the dural tube encompasses the skull all the way down to the sacrum. And the dural tube actually has a pulse of about 8 beats per minute. And so when you fall asleep, often when we're switching over from sympathetic to parasympathetic, that roller coaster feeling is us feeling the dural tube flow right before we go to sleep, interestingly enough. And so CST is a very non-invasive, very, very gentle technique that has the least amount of pressure on the head, neck, and back. It relieves stress and pain caused by compression. It can, as a result, help to treat a number of conditions. It's thought through the gentle manipulation of the bones in the skull, the spine, the pelvis, the flow of the cerebral spinal fluid in the central nervous system can be normalized. And in that, any blockages from the normal flow then enhances the body's ability to heal once you undo those blockages, or the adhesions, they like to say. So this practice is used across the platform. You can find old school osteopaths doing something very similar to this. Chiropractors, physical therapists, massage therapists, even bone setting doctors in the ER are starting to do some of this because it's more gentle and they tend to not have as many breaks. And so this can be a part of an already scheduled treatment or visit directed towards just one element of the practice. So cranio-sacral, so there's 3 different positions. And so what I want to introduce is the 3rd position, which is the sacral position, because this is what we're addressing in dysmenorrhea. It's usually all the pain down here in the sacral region. And so here is Maren and I's video on that. We are addressing menstrual pain, dysmenorrhea pain, as well as lower back tailbone issues. And so there's going to be a practitioner move as well as a home moves to do to regulate your own pain down here. And so the first practitioner move is craniosacral therapy. And so Maren's going to lift her tailbone up off the table and come back down. Good. And so now I have her like this. And essentially, craniosacral therapy is a combination of unwinding tissue, and it's very gentle, and it's very slow. I'm doing it fast to demonstrate what craniosacral is. And essentially, we unwind all the tissue here, and in the same time, we're heating it up with the temperature of our hands. And so this could take 5 to 10 minutes, sometimes 15. And so this is a 2-stage effort to do at home on your own. And now Maren will lift up and I'll show you. And the first effort is the bottom, the tailbone issues. You're going to put your hands like a diamond, and then you're going to slide them underneath right where your tailbone is. And so you're creating a valley for your tailbone to fall and regulate the tailbone. And so from there, you could sit and wait 10 minutes, something we could do in the mornings usually when we're getting out of bed. And so in the process of this, you're helping your lower back, your tailbone, all that tightness that we can get during that time of month. And then the second phase of this effort is more related to the cramping and pain down here. And so Maren will take her hands out. And so this is just a concept of warmth, of literally like your own heating pad. And when you look at cramping and pain for menstruation, you typically are looking at cold to the area, cold invasion, whether they're drinking the cold or eating the cold or running around with the wind blowing across their navel. And those are the things that we can do to address this. And in this position, you could sit for 5 to 10 minutes easily. If not, get a hot water bottle or a heating pad to cover the area. And this is some of the efforts we have for pain during the menstruation and lower back pain. So next we have Maren to discuss yoga poses for dysmenorrhea.
So with dysmenorrhea, well, yoga is actually it's very gentle. It can be restorative, but then it can also be very vigorous. During this time when you have your periods, in general, you're expected to do yoga poses that are more restorative. So the purpose of these poses are to help the chi flow move and also to help the blood flow as well. So these are the examples. And then we have a video for that. Casey?
So for the first move for menstrual pains, so the problem with menstrual pains is usually it's blood stagnation or chi stagnation. So it's not moving, the energy is not moving as much. So what we want is like to do some poses that will allow us to like stretch things and help move the energy. So the first one, which is pretty easy, it's called forward bend. You have to keep your feet hip width apart. You can bend it a little bit, start on your hips, and then just basically fold forward. You can grab your toes if you want. You can
bend your knees a little bit if you need to. But the point is, you just have to like let the gravity pull your back down, and then as much as possible, move your weight towards the balls of your feet. So you can do this for about 5 to 10 breaths. And then when you go up, just roll slowly up.
So that's the first move. So the second one is called bound angle. So for this one, you have to sit on your mat. Do a butterfly. So ideally, if you're flexible, just bend forward, or you can get a block and then put your head right here. So you can stay that way for about a minute if you can. So it's quite relaxing like this. Or you can do like this too, if you're flexible enough. So 5 to 10 breaths or a minute. The second one is called reclined bound angle. The reclined bound angle is basically your feet are together, your legs are folded in a diamond position, and then you're basically just going to lie down like this, right? You can put your hands, one hand on the belly and one hand on the chest. So again, you can stay here for about a minute, 5 to 10 breaths, just to help your body recover. And the next one is child's pose, which is pretty easy. So for child's pose, you can have your weight on the heels of your feet first, and then just fold forward. You can use a block, put that right there, and then just stay that way. Or
Just completely fold for about 5 to 10 breaths again.
so the whole point of that is just to help ease the pressure off your back. The next one is called the wide angle or forward fold, which is basically you're on split. Okay? It doesn't have to be super wide. It can be like this if that's the only way you can reach it. Like this. Again, if you're flexible, you can do this. Just move your hands forward and then just rest like that. Better if you flex your feet. Or if that's too much for you, just get a block. Rest your head. And then stay like this. So some people will be a little bit tight on the on the thighs, in the inner thighs. So you can just adjust your block as close as possible or as far as you can. Or as low as you can. Or no blocks. So 5 to 10, again 5 to 10 breaths. The other one is actually, even if you don't have dysmenorrhea, this is actually pretty good for you. It's basically a reclining twist. So lie down, hold one of your legs, make sure it's hooked to one of to the other knee, and then just scoot a little bit, and then just move like that. Try to look the other way. Don't force it. But if you can, try to reach the floor with your knee, or just stay like this. So if you're gonna do that, do it on the other side. Also for 5 to 10 breaths. And the next one is called the inverted, it's a relaxed shoulder pose, shoulder stand. So it's better if you have a wall, assuming I have a wall. So basically, you just lie down, lift your legs up, and stay like this for about 5 to 10 breaths again, or a minute if you can. If you want, you can put the block underneath your sacrum and lift it like that. So again, better if you have a wall so that you can be more relaxed. So 5 to 10 breaths, or a minute, or 5 minutes, for as long as you like. Okay. The last one is called the Janushirasana 1. Basically, pull one of your legs, put your foot onto the side of your inner thigh. If you can, put it close to your crotch, basically. And then again, you can fold forward. Try to reach it. Take a deep breath and fold forward. Or if that's too much again, use the block and then put your head down for 5 to 10 breaths again, or a minute, and then do the other side. So those are the yoga poses that you can do when you're having menstrual pains.
So the other recommendations to have to help with dysmenorrhea, heat therapy is actually pretty good, which is the same as getting a heat pad and putting on your abdomen or your lower back. High or low intensity exercise like running, cycling, not too much, yoga and stretching, tai chi or Pilates. Acupressure or getting a massage is actually good. They said that changing a little bit of your diet, like adding more fish or omega-3 fatty acid rich foods like fish, calcium, vitamin D, and food low in animal fats can be good. Avoid foods that are high in salt and also caffeine. And like I mentioned, it would also benefit you if you decrease intake of processed foods, because it can cause inflammatory reaction in your body. Especially when you're having dysmenorrhea, you should hydrate more and take herbal teas like chamomile. Chamomile is very relaxing and soothing. And also quit smoking, because like I mentioned, it can cause a low oxygen supply within the body. And it's not really good in the long. So that is our presentation for dysmenorrhea.